Hi, this is George with 573 Medicine, and in this video we're going to be discussing Introduction to Hematology and Peripheral Blood. So let's get started. Here we can appreciate a picture on the left, which, if this isn't looking like it makes a lot of sense to you, I would recommend checking out our prior video on early fetal development. The things that we want to point out are these words in red. So totipotent, pluripotent, and unipotent. Totipotent stem cells are in the morula, so remember that after the sperm fertilizes the egg or the oocyte, this complex rapidly divides, and on day 4, this complex is now known as a morula, so formula is how I keep that straight in my head. And totipotent stem cells can differentiate into all different types of cells that would make up the placenta or the embryo. Pluripotent stem cells can develop into any cells of the embryo, specifically the embryoblast or the inner cell mass, but pluripotent stem cells can't differentiate into cells that make up the outer cell mass. And so totipotent stem cells can differentiate into cells that make up the inner or the outer cell mass, whereas pluripotent stem cells can only differentiate into cells that are with the embryoblast, that are derivatives of the embryoblast. Unipotent stem cells can differentiate into any cells that form after the primitive streak. So remember that the primitive streak will divide the inner cell mass, also known as the embryoblast, into the ectoderm, endoderm, and mesoderm. So unipotent stem cells can differentiate into one of these germ layers. And so totipotent is all cells. Pluripotent stem cells can develop into cells that make up the embryo. And unipotent stem cells can make up cells that are from a specific germline after gastrulation of the inner cell mass. So remember, totipotent stem cells are from the morula, so on day 4 after fertilization, while this fertilized egg is dividing, and these cells can become the cytotrophoblast, which is also known as the embryoblast, which is also known as the inner cell mass, and these cells can become either the cytotrophoblast, which are cells of the embryo, or the syncytiotrophoblast. And remember, the syncytiotrophoblast is responsible for secreting beta-HCG to promote progesterone secretion from the corpus luteum early on in pregnancy. Pluripotent stem cells are the cells that make up the inner cell mass, which is also known as the cytotrophoblast. And the inner cell mass, we remember, can develop into the hypoblast, which is the yolk sac, the membrane-bound sac that surrounds a growing embryo, or the epiblast, which is going to be divided into the endoderm, mesoderm, and ectoderm after gastrulation. Unipotent stem cells are stem cells from a specific germline from after the primitive streak is formed. So remember that mesenchymal stem cells are undifferentiated mesoderm. And so mesenchymal stem cells are an example of unipotent stem cells, and mesenchymal stem cells can develop into blood, bone, kidney, muscle, but not skin, because skin is derived from the ectoderm. This is a mistake. This should say ectoderm instead of mesoderm. Next, sort of shifting gears, here is a picture of a long bone. This is going to house an important structure called bone marrow, which is going to play an important role in hematopoiesis. So first, just to sort of orient ourselves, the cortex, think of as the outer shell of this bone. So here we have the cortex, and this cavity in the middle is the medulla. So if you're thinking about it like a Twinkie, the medulla would be sort of where the cavity where you have the cream, and then the cortex would be like the bread. In the medulla of most bones, there is bone marrow, and there are two types of bone marrow. There is red bone marrow, which is functional and aids in hematopoiesis, which is the generation and differentiation of blood cells. There's also yellow bone marrow, which is primarily made of fat. So hematopoiesis occurs inside of red bone marrow, and this is the generation and differentiation of blood cells. Just a side note, an immature blood cell has the suffix blast. So a mesenchymal stem cell, also known as a hemocytoblast, which is also known as a multipotential hematopoietic stem cell. A hemocytoblast is an immature blood cell. Similarly, an erythroblast is an immature red blood cell, And an erythrocyte is a mature red blood cell. So the immature blood cell has a suffix blast. So going on to this mesenchymal stem cell, the hemocytoblast, these cells can differentiate into different types of blood cells. They can either be myeloid or lymphoid. So let's say that these cells differentiate into lymphoid progenitor cells, cells that come from the lymphoid lineage. We can get ultimately T lymphocytes, B lymphocytes, and remember that B lymphocytes can also differentiate into plasma cells as they mature, or they can develop into natural killer cells, which are also known as large granular lymphocytes. Or if this hemocytoblast decides to go into the myeloid progenitor, it can differentiate into other different cell types. So for instance, megakaryocytes, basophils, neutrophils, eosinophils, monocytes, mast cells, macrophages, basically everything else. So it's not a B cell, a T cell, or a natural killer cell. Think myeloid lineage. Furthermore, white blood cells can be differentiated into granulocytes and agranulocytes. So granulocytes are white blood cells with granules. From the myeloid lineage, we have the neutrophils, eosinophils, and basophils. And from the lymphoid lineage, we have the natural killer cells. We also have agranulocytes, which are white blood cells without granules. And these come from the myeloid lineage, which would be the monocyte, as well as the lymphoid lineage. And that's going to be our B and T lymphocytes. Additionally, in addition to white blood cells, we also have red blood cells, and that's going to be our erythrocytes. So next, we should understand that all nucleated cells express major histocompatibility 1 receptors on their membrane. And this is a sign to the immune system not to destroy the cell because it is expressing proteins to tell your immune system not to destroy your own cells. And the way that I remember this is that class 1 citizens are very common. There are many different types of cells with nuclei, which are nucleated cells and have MHC1. There are special cells that express major histocompatibility 2 receptors, so MHC2 receptors, and that's going to be our dendritic cells, macrophages, and B cells. And so these cells are going to engulf extracellular pathogens and express these pathogens on MHC2 receptors to activate T cells in order to initiate a robust immune response. And these are going to express extracellular proteins. Sort of shifting gears, we have normal bone marrow. And here we can appreciate the compact bone, the cortical bone, the hard bone, and it's incredibly thick. In the middle, we can see hematopoietic cells. We can also see sinusoids, which are fenestrated capillaries with red blood cells. And these sort of vacuoles right here are adipocytes or fat cells. So next, we're going to appreciate this tube of blood. So imagine we take blood from a patient's vein and then we centrifuge this blood. And we're going to get the plasma, the buffy coat, and erythrocytes. So plasma is a majority of this blood, and it's going to be 55% of the blood, and it's going to have the least density. The buffy coat is less than 1% of total blood, and this is going to be medium density. And erythrocytes are the most dense substance of this blood, of total blood, and about 45% of total blood are erythrocytes, and that's going to be our red blood cells. So from superior to inferior, we have the plasma, which is primarily water, but also there are some proteins and electrolytes. And something that might be a little bit confusing is that you'll hear the words serum and plasma sort of used interchangeably, but they're actually very different because serum is plasma without clotting factors. So serum is used in the diagnosis of diseases, whereas plasma is used in giving patients blood transfusions when they need additional blood cells. The buffy coat contains leukocytes or white blood cells, which are composed of neutrophils, lymphocytes, monocytes, eosinophils, and basophils. And these percentages are actually relatively important because blood diseases can change the distribution of the cells in the buffy coat. Finally, we have the erythrocytes, or the red blood cells, and these contain hemoglobin, which is an important molecule in transporting oxygen from the lungs to other tissues in the body. So first, we're going to be talking about erythrocytes. So these are our red blood cells. Erythrocytes are 7.5 microns, and these are a ruler to compare relative to other blood cells, because remember, we have a lot of red blood cells relative to white blood cells in the buffy coat. And so we can appreciate that there's no basic stain, there's no nuclear material. So the erythrocytes do not have any nuclear material. And these function in the transport of oxygen to peripheral tissues via the hemoglobin protein. We can appreciate a biconcave disc with central pallor, so paleness in the middle, which is up to 1/3 of the diameter of the entire erythrocyte. And so sometimes you'll have red blood cells that have no paleness in the center, and that can be a sign of disease. Erythrocytes also have a lifespan of 120 days. And this is sort of a clinical tie-in that helps me remember this, is that this 120 days is important clinically because hemoglobin A1C is a different type of hemoglobin which is used in the diagnosis of diabetes, and this estimates 3 to 4 months of blood sugar because of the life cycle of the erythrocyte. Next, we're going to be talking about leukocytes, or white blood cells, which are going to be, and even further, we're going to differentiate granulocytes, which are types of leukocytes, or white blood cells. So we just talked about red blood cells, now we're talking about white blood cells. And a subcategory of white blood cells, we're going to be talking about white blood cells with granules, or granulocytes. So the first cell we're going to appreciate is a neutrophil, which is also known as a PMN, polymorphonuclear neutrophil. So that tells you a lot. So poly meaning many, morpho meaning shape, and so there are a lot of different shapes of the nuclei. Remember, the nuclei are going to stain blue or basophilic. So neutrophils have less than 6 lobes of nuclear material, but the lobes have different morphology, and these are phagocytic white blood cells. Phagocytic meaning actually translating to eating, and these are going to sort of eat or engulf bacteria and other debris, and they have an important role in innate immunity. And neutrophils are always a sign of acute inflammation, so our body's response to pathogens, allergens, or necrotic debris. And a large component of pus and abscesses due to infections are going to be neutrophils. Two other types of white blood cells are going to be our eosinophils and basophils. So eosinophils play an important role in the allergic response of the body, as well as defense against parasites. The granules contain major basic protein, an important antiparasitic protein, and contain a bilobe nucleus. And eosinophils love eosinophilic dye. So phile meaning love, eosin meaning eosin dye, and so they love eosinophilic dye. So eosinophils love eosinophilic dye. So they're bilobed and have granules, and they are going to stain pink because they love eosin dye. Basophils also have a bilobe nucleus, and these also mediate allergic reactions. The granules contain heparin, which is an anticoagulant, histamines, which are a vasodilator, and leukotrienes, which are going to be important in the inflammatory response. The next type of granulocyte is the large granular lymphocyte, which is also known as natural killer cells. And these cells destroy cells which express no MHC1 or express abnormal MHC1. And these cells are derived from the lymphoid lineage. Next, we're going to be talking about leukocytes, white blood cells. So leukocyte and white blood cells are the same thing, but these are going to be white blood cells without granules, so agranulocytes. So the very first thing we can appreciate is the lymphocyte. And the lymphocyte has an incredibly high NC ratio, and this is going to be something that you hear a lot about in histology. So NC stands for nucleus to cytoplasm. So here we can appreciate a very large nucleus and not a lot of cytoplasm. So lymphocytes have a very large NC ratio, and you can't really tell whether they're a B or a T lymphocyte. T lymphocytes can either be CD4 positive or CD8 positive. And so CD4 positive lymphocytes are known as helper T cells, and these are going to form complexes with antigen-presenting cells. So those are the cells that are going to express MHC class II in order to promote a robust adaptive immune response. CD8 positive T cells are going to be cytotoxic T cells, and these are going to destroy abnormal host cells. So virally infected or cancerous cells are going to be self cells that have kind of gone rogue and need to be destroyed by the immune system. And so if you remember, antigen-presenting cells express MHC class II. So that MHC2 will form a complex with CD4, so 2 times 4 is 8. And if you remember that all nucleated cells express MHC1, whenever they express abnormal host cells, these abnormal MHC1 complexes are going to bind to CD8 positive T cells, and the CD8 positive T cells are going to destroy these cells with abnormal MHC1 receptors. So MHC1 and CD8 are going to form a complex, so 1 times 8 is 8, and 2 times 4 is 8. So that's a way to remember what MHC receptor forms a complex with T lymphocytes, and that's known as the rule of 8s. B lymphocytes are going to differentiate into what are called plasma cells. And plasma cells are going to produce antibodies that aid in adaptive immunity. And they have a perinuclear HOF, which have a clock phase nucleus due to the chromatin in the nucleus. And so I think this is a better picture to appreciate the perinuclear HOF. And the reason why we have a perinuclear HOF is actually because of excessive or a large amount of use of the ribosome that lines the rough endoplasmic reticulum, because these cells have to produce a lot of proteins, because immunoglobulins are proteins important in our robust adaptive immune response. So sort of shifting gears, this is actually a very confusing term. So monocytes are going to be found in the peripheral blood. And here we can appreciate a picture of a monocyte, of monocytes, 2 different monocytes. And whenever monocytes enter tissues, they're going to be called macrophages. And these cells have an important role in engulfing extracellular pathogens. We can appreciate the kidney bean-shaped nucleus. Macrophages are examples of antigen-presenting cells, which means they express that MHC2 molecule, which plays an important role in adaptive immunity. These cells can become activated and wall off infections, and so this complex is known as a granuloma. So things like tuberculosis and inflammatory bowel disease, you're going to see granulomas, which are activated macrophages. And so it gets a little bit more complicated than just calling them monocytes or macrophages. So remember that those cells with the kidney bean-shaped nucleus are called monocytes in the peripheral blood, but they're considered macrophages when they enter tissue from the peripheral blood. Unfortunately, there are many different types of macrophages, depending on the type of tissue they're in. So it's not enough just to memorize macrophages. Whenever you actually get to looking at the histologic images, it's important to remember that in the lungs, they're considered alveolar macrophages, but macrophages in the kidney are mesangial phagocytes, and in the liver, they're Kupffer cells. And in the bones, they're osteoclasts. In connective tissue, they are histiocytes. And in the brain, they're called microglia. Next, we're going to shift gears and talk about cells involved in platelet synthesis, or thrombopoiesis. So here we can appreciate 2 incredibly large cells, and these are the megakaryocytes. The word mega means big, so these are really mega relative to, say, the surrounding red blood cells. Platelets are going to bud off of the megakaryocytes, and megakaryocytes also have a very large and round nucleus. Platelets are going to be also known as thrombocytes, and these are part of the membrane/cytosol of megakaryocytes. So they're really just parts of the membrane and the cytosol of the megakaryocytes, and they're much smaller than the surrounding erythrocytes or red blood cells, and they're important in the formation of blood clots. So that's it for this video. If you liked the video, feel free to like, comment, and subscribe, and email us anytime at realtalkmeded@gmail.com for any questions, comments, or concerns.